So by now you're probably wondering, what causes thyroid cancer? Well, I want to say there's not really a clear-cut way to say what causes thyroid cancer, but what's going on, everybody, and welcome to the Easy Thyroid channel. Today we are going to be looking at what is thyroid cancer. Now, without any further ado, let's get started. So the first question is, what is thyroid cancer? Now, thyroid cancer is a cancer that starts in the thyroid, and I think that was pretty obvious, right? Yeah. So thyroid cancer, at first it wouldn't cause any symptoms, but as it grows, then it will cause pain in the neck. Now, there are different types of cancers which we will soon look at, but some of these cancers, they grow slowly, and some of them are more aggressive, But in most cases, the cancer can be treated. Now, let's look at 4 types of cancer. There are more, but today we will just focus on 4 of them. And the first one is papillary thyroid cancer. Now, papillary thyroid cancer comes from cells known as the follicular cells, which create and store thyroid hormones, and it's the most kind of prevalent thyroid cancer. Now, papillary thyroid carcinoma can strike at any age, although it's most common in adults between the ages of 30 and 50 years old. The follicular thyroid cancer is our second one. Now, the thyroid follicular cell can also cause follicular thyroid cancer, and persons above the age of 50 years old are generally affected. Now, guys, I don't know if you ever heard about Hurther cell carcinoma, but this is also a kind of follicular thyroid cancer. This one is uncommon and potentially more aggressive. The third one we're going to look at is anaplastic thyroid cancer. Now, this one is the most advanced and the most aggressive type of cancer there is. Now, anaplastic thyroid cancer is very rare. However, it's found in less than 2% of patients with thyroid cancer, and it usually affects persons above the age of 60 years old. So the last type of cancer we're going to look at is the medullary thyroid cancer. So thyroid cancer in the medullary region originates in cells called the C cells, which generate the hormone calcitonin. Now, calcitonin levels in the blood can suggest medullary thyroid carcinoma in its early stages. Now, although this genetic relationship is infrequent, there are some genetic disorders which enhance the risk of medullary thyroid cancer. Now, guys, if you've been finding this information valuable, then I want you to consider becoming a subscriber. Click on the post notification bell so that you'll be notified when I upload a video. So by now you're probably wondering, what causes thyroid cancer? Well, I want to say there's not really a clear-cut way to say what causes thyroid cancer, but there are certain things that increases your chance of getting it, such as 1. Having a non-cancerous thyroid condition, 2. Exposure to radiation, 3. And please don't kill me, but if you're a woman, and I say this because women have a higher tendency of having thyroid disease than men, therefore the risk of having thyroid cancer is greater in women. And I'm not saying that every woman who has thyroid disease will get thyroid cancer. Now, if you have certain inherited genetic symptoms, then that also increases your risk of thyroid cancer. There are other factors, but for now, we will just stop there. So, right now, you're probably wondering, okay, what are the options available to treat the thyroid cancer or any type of cancer? Now, the first option I would suggest is not very popular, but if you follow the guidance given, then you can be cured. And my first suggestion is to see a herbalist. Now, herbalists, they offer natural remedies that can treat any type of cancer. And doing this way, however, will take time because that is just how nature is, But let me tell you that when nature does its thing, it does its thing, honey. And more importantly, I want to encourage you to pray, and that goes for whichever option you choose, because I firmly believe that if it's God's will that you will be healed, then you will be healed. Another option is a thyroidectomy. Now, depending on your situation, all or part of your thyroid will be removed. Now, having this type of surgery has its risks, such as bleeding and infection. Now, some time ago, I created a video talking about whether or not you should have a thyroidectomy. But what I can do for you, I will leave the link in the description so that you can check it out after this one. There's also another option is radioactive iodine treatment. Now, this is often done after the thyroidectomy. What it does, it destroys the remaining healthy thyroid issue as well as any traces of cancer that were left after the surgery. Then there is chemotherapy, which is another option. Now, with this option, it kills the cancer cell as well as any cells that may be growing. So yes, it kills the good cells as well as the bad ones. Then there is targeted drug therapy. Now, targeted medication therapies are designed to target particular abnormalities seen in the cancer cells. Now, targeted medication therapies can kill cancer cells by inhibiting these abnormalities. Thyroid cancer medication therapy that targets the signals that instruct cancer cells to grow and divide is called targeted therapy. So it's the most commonly used to treat advanced stage cancer. So guys, these are just some of the options, and that is pretty much it for this video. Remember, if you want free recipes for hypothyroidism, I will leave a link in the description. So don't forget to like, comment, and subscribe. Until next time, bye.